Good morning, good morning, good morning. This is Nurse Eunice with Florida Training Academy. And in today's video, we're going to be reviewing common heart conditions. So if you are a nursing student, if you are a CNA, this is the place to be. And so as you come in, please put your name, where you're from in the chat. And as we do in every video, we'll get started in 10 seconds to give you time to receive your notifications. Hi, everybody. All right, so let us begin. Yes, we have a Black Friday sale. So if you go to our website, which is fltraining.com, and tomorrow is Thanksgiving. So happy early Thanksgiving, everybody. And of course, the day following is Black Friday. If you want to support us, if you want to purchase our workbook, just go to our website, click on the exam prep book, and you'll be able to purchase it for $9.99. And I will also have additional PDFs that you can download so that you can be practicing more questions to make you more knowledgeable and to help you pass your certification exam. So let's begin, everybody. All right, so question number 1. Which of the following is a primary cause of coronary artery disease, or CAD? Is it A, hypertension, B, atherosclerosis, C, myocarditis, or D, pericarditis? And good morning, Carrie and Karen and Combs. Let's see if you know the correct response. And I'll be revealing the answer in about 5 seconds. So 5, 4, 3, 2, and yes, you are correct. So if you chose B, atherosclerosis, the buildup of plaque in the arteries, that is actually the main cause of coronary artery disease. So it would not be myocarditis, it would not be C. Because the atherosclerosis, or the buildup of the plaque, it restricts the blood flow to the heart muscle, therefore causing ischemia or tissue death. So atherosclerosis is the leading cause of coronary artery disease. All right, let's go to our next question. All right, so question number 2. What is the hallmark symptom of angina pectoris? Is it A, dizziness, B, shortness of breath, C, chest pain, or D, palpitations? So the question wants to know really if you know what angina is. All right, so let's see if you can figure it out. And I'll give you a few moments. So let's reveal the response in about 5 seconds. And yes, you have it correct. Great job, team. This one was C also. So angina pectoris typically presents as chest pain due to reduced blood flow to the heart muscles. Question number 3. I know you're going to get this right. Which of the following medications is commonly used to manage heart failure? Is it A, beta blockers, B, antibiotics, C, anticoagulants, or D, antivirals? There is no way you're getting this one wrong. And so we'll reveal the answer in about 5 seconds. Let's see those responses in the chat. And you are correct. It is a beta blocker. So beta blockers help reduce the workload on the heart by slowing the heart rate and decreasing blood pressure. This is crucial in managing heart failure. And the way we like to think of the beta blockers, it's the LOLs, because pretty much all of the medications, they end in LOL. For example, metoprolol, it could be atenolol, it could be asmolol. So if it ends in LOL, it helps to decrease the patient's heart rate, to give the heart time to pump better. And so that's how we're going to manage heart failure in patients who have coronary artery disease. All right, so here we go. Question number 4. Which electrolyte imbalance is most likely associated with arrhythmias? So an arrhythmia is an irregular heartbeat. So which electrolyte imbalance is associated with irregular heart rhythms? Is it A, hyperglycemia, B, hypercalcemia, C, hypokalemia, or D, hyponatremia? Oh, it's so early in the morning to be pronouncing all of these big words. So I'm going to need another cup of coffee. And let's see if you all can get this one correct. We'll give you the correct response in 5, 4, 3, 2, and you're so close. Give me another answer. Delhi, Wagatha, Coons. Is there another choice? All right, so I'm going to show it to you now so you all have learned something new. It is hypokalemia. So remember, the heart needs potassium in order to pump. So, if someone has low potassium levels, kalemia, it can cause dangerous arrhythmias by affecting the electrical conductivity of the heart. So, if you didn't know that, go ahead and write it down because I'm sure that as you progress into nursing school, that's going to be something you're going to see again on a future test. All right, so question number 5. What diagnostic test is most commonly used to confirm a myocardial infarction, MI, myomuscle heart infarction death? So pretty much the person had a heart attack. What diagnostic test do we use to confirm that? Is it an MRI, an ECG, a chest X-ray, or an echocardiogram? And I see a few correct responses. I will give you about 5 more seconds to enter your responses into the chat. And you all have it. So Rachel, Jimeline, Coombs, and I think it was someone else. Great job. Yes, it is ECG. And so whether you say ECG or EKG, it just depends on what country you're from. So in America, we usually say EKG, but the correct term is electrocardiogram with a C. So that's why it's supposed to be ECG. So an ECG can detect abnormalities in the heart's electrical activity that occur during a heart attack. And when you look at the actual rhythm, you'll usually see an elevated ST segment. And if you don't understand what that means right now, all I need you to know is that if we think someone's having a heart attack, that doctor's going to order an EKG to confirm it. So an EKG, ECG, same exact term, just depends on what country you're located. All right, so everybody, question number 6. In atrial fibrillation, AFib, which of the following is the primary concern? Is it A, decreased cardiac output, B, bradycardia, C, valve regurgitation, or D, risk of embolism? Ooh, this one's tricky. Ooh, what do you think, team? Yes, we get up early in the morning and we do practice tests because we love you. All right, so I'm going to reveal the answer in 3, 2, and I know it was tricky, you all. So with atrial fibrillation, what I like to think of with AFib is as the heart pumps normally. Okay, so if the heart's pumping normally, the ventricles, the very base of the heart, is what circulates the blood throughout the body. But with atrial fibrillation, everything's just quivering. So the blood is stagnant. It's just sitting there. And because it's sitting there, a clot can form. And then if that clot is pumped out of the heart, that's called an embolus. So it can travel and cause a heart attack. It can cause a stroke. So AFib can lead to the formation of blood clots in the atria, which can embolize, that means travel, and cause a stroke. So if anyone has that abnormal heart rhythm called AFib, they are more likely to have strokes, and therefore they are usually placed on blood thinners to keep the blood thin. All right, team, question number 7. Which of the following is an early sign of a left-sided heart failure? Oh, I know this is a lot to think about early in the morning. So it's just not heart failure because your heart has different sides. So which side is failing? Is it the left side or the right side? And depending on which side is failing, the symptoms are going to be different. So with left-sided heart failure is an early sign: peripheral edema, jugular vein distension, pulmonary congestion, or hepatomegaly. Oh, I know this one's tricky, but we're going to reveal the answer in about 6 seconds. So let's go, team. 5, 4, 3, 2. Great job, Wagata. Great job. It is C. Yes, it is pulmonary congestion. And so here I have an image for you. So, pulmonary congestion. The left sided heart failure leads to fluid buildup in the lungs, causing symptoms such as pulmonary congestion and shortness of breath. So, when you all think of heart failure, you typically think about the legs being swollen. Well, that's like right sided heart failure. With left sided heart failure, it's going to back into lungs. And as you can see on this image here, because the fluids aren't circulating properly, it's just sitting in the lungs. It's causing that congestion. And what would you hear as a CNA? What would you hear as a nurse? You're going to hear those coarse lung sounds. Your patient may start desaturating. So, as a reminder, not every respiratory condition is due necessarily to the pulmonary system. If they are having cardiovascular problems, that fluid can back up and then, as a result, cause the respiratory condition. So that's why we work together. CNAs notify the nurses notify the doctors so that we can get the patient examined. All right, so next one, everybody. Question number 8. What is the primary goal in managing hypertensive emergencies? All right, so is it A, increasing the heart rate, B, lowering the blood pressure, C, normalizing cholesterol levels, or D, treating underlying infection? This one is so easy. Don't make it hard. Don't make it hard. If someone has a hypertensive emergency, what do you want the outcome to be? Revealing the answer in 3, 2, and you are correct. We want to lower the blood pressure. So a hypertensive emergency requires immediate lowering of the blood pressure to prevent damage to the organs. All right, so question number 9. Which valve is affected in mitral valve prolapse? I got my fingers crossed. There is no way you're going to get this one wrong. Is it A, tricuspid valve, B, mitral valve, C, aortic valve, or D, pulmonic valves? And the way that we like to remember our valves is we come up with little crazy songs. And so we'll say all pigs eat too much. And so when you're in nursing school, mnemonics is going to help you out so much. So we have the tricuspid, mitral, aortic, and pulmonary valve. And so we know that if the valve affected is the mitral valve, is in mitral valve prolapse, it is referring to the mitral valve, which is in the here it is right here in the picture here. So the MVP occurs when the mitral valve doesn't properly close, leading to blood leakage back into the left atrium. So the blood is just backing up. It's not going into circulation. Our next one, team, question number 10. What is the primary symptom of pericarditis? So what does peri stand for? If you remember your prefixes, does peri stand for inside the heart or around? Okay, so peri is around. So pericarditis. And so the suffix itis refers to inflammation. So let's put it all together. What's the primary symptom of pericarditis? Is it A, sharp chest pain, B, persistent cough, C, hemoptysis, or D, night sweats? And so when you break down the term, that should help you understand the symptoms. And so for question number 10, if you chose, looking for the correct response, yes, Kimberlyn, if you chose A, you are correct. If someone has swelling around their heart and due to it could be due to infection, but also inflammation, the correct response is going to be A, sharp chest pain. So pericarditis, inflammation of the pericardium, typically causes sharp chest pain that worsens with deep breathing or lying down. All right, so question number 11. What is the key feature of congestive heart failure? We shorten it and call it CHF. Is the key feature weight loss, frequent urination, fluid retention, or tachycardia? So when someone has CHF, how do they present? And let's see if we have any correct responses. All right, we'll reveal the answer in three, two, and Karen has it. All right, because the heart is failing, remember the heart pumps. And if the pumper stops pumping, everything just gets congested and backs up into the lungs or it backs up into the legs. And so they're going to have C, fluid retention. And so these patients usually require daily weights. You'll have to get them up in the morning before they eat, have them void or urinate, use the bathroom, and get them on a scale. Because if they gain more than 3 pounds in a short time frame, that means that their CHF is worsening and that additional medical interventions or treatments would be warranted. So CHF is characterized by the heart's inability to pump effectively, leading to fluid retention in the lungs and the extremities. And so, bonus question, what type of diet would these patients be on? If they have CHF, what follows? Fluids follow what? So they're usually going to be on a low sodium diet, because if they're eating a lot of salty foods, processed foods, well, then they're going to keep retaining fluid and it's not going to make their heart condition any better. All right, so question number 12. What is the first line treatment for acute, means that it's sudden, myocardial infarction, or AMI? Again, another way of saying a heart attack. Is it A, oxygen therapy, B, thrombolytics, C, beta blockers, or D, aspirin? It is not C, everybody. Think first aid. If someone's having a heart attack, what do you give them? And this is, if you're in a hospital, of course, the nurses would be giving this medication. But if you're a first aid provider, it doesn't, and you're outside of a hospital, you would be able to give the person medication. So what medication would you be giving them if they were not allergic to it? And so for this one, everybody, it is not oxygen. That's not the first line treatment. The first line treatment is so easy. I know you know the answer. Give me a different answer, everybody. In 5, 4, 3, 2, and looks like Karen in America has it. Yes, it is D, aspirin. So simple, right? In the medicine cabinet. Usually, especially patients who already have heart conditions, they're going to have low dose aspirin, previously referred to as children's aspirin. It is chewable. And the reason why we give aspirin is because it helps to thin the blood. So oxygen is not the first line treatment. When someone's having a heart attack, it is because of poor circulation in the area. The heart is dying. So if you give oxygen, but you don't thin the blood, remember the oxygen is carried in the actual blood cell. So if we just give oxygen, but we don't thin the blood in order to get the oxygenated blood to the blocked area, we're not helping them. So we're going to thin the blood. Hopefully that's going to improve circulation and decrease their chest pain. All right, so our next one, team. Question number 13. What is the most common risk factor for developing peripheral artery disease, or PAD? Would it be diabetes, smoking, obesity, or sedentary lifestyle? And yes, they are all risk factors, but which one is the most common risk factor? Let's see if you can get the answer. And thank you all for waking up bright and early on a Wednesday morning and studying with Nurse Eunice. I appreciate you. All right, so for this one, revealing the answer in 3, 2, and let's see, one more response and I'll show the answer. It is smoking. I know, because we don't see a lot of people smoking anymore. So we forget that, yeah, smoking is a major cause of coronary artery disease. And also peripheral artery disease. What I want you to know is that even though we don't see people physically smoking cigarettes, now they're vaping or they're smoking other substances. And so it doesn't matter what they're smoking. It's going to increase the risk of narrowing the arteries. And of course, if we don't have circulation to the arteries, especially in the feet, that's when they're going to start having that numbness and that tingling, which would be symptoms of peripheral artery disease or PAD. So smoking, vaping reduces blood flow to the limbs. And the others are also factors, but smoking is a Well, that was just odd. I do apologize. Looked like we lost signal there, but I will go ahead and put this screen back up. So just bear with me. While we're waiting, while I'm putting this back up, what are your holiday plans? Are any of you all going out of town? Are you traveling? All right, so let's get back to the slide that we were on. And I can't remember. I think it was this one. We'll start here. All right, I'm going to all right, so technical difficulties. I want to make sure that you all don't see the response. All right, so this is the actual slide that we left off on. All right, so again, I apologize for the technical difficulties. Not sure what happened, but here we go. Question number 14. Which condition is characterized by an irregularly irregular heartbeat? Is it A, ventricular tachycardia, B, atrial fibrillation, C, sinus bradycardia, or D, supraventricular tachycardia? And now reveal that answer in about 5 seconds. Irregularly irregular heartbeat. All right, so in 5, 4, 3, 2, and yes, it is B, atrial fibrillation. So AFib is known for its irregularly irregular rhythm caused by disorganized electrical signals in the atria. So don't forget that if a person has atrial fibrillation, the way Nurse Eunice likes to think of it is the heart is just quivering. Okay, so it's not pumping effectively, it's just quivering. This person is going to be more likely to have blood clots, which could travel and cause a stroke. So they're going to be on anticoagulations or anticoagulant therapy. Question 15. What is the primary cause of holiday heart syndrome? And so this is important because we're approaching the holidays. And so people are going to start having cardiac issues that they've not had before. All right, so is it A, alcohol consumption, B, increased sodium intake, C, high cholesterol levels, or D, lack of physical activity? What is the primary cause of holiday heart syndrome? And I'll reveal that answer in 5 seconds. So 5, 4, 3, 2, And you are absolutely correct. It is A, alcohol consumption. So, holiday heart syndrome is a term for arrhythmias, particular atrial fibrillation triggered by excessive alcohol intake during festive periods. Alcohol disrupts the heart's electrical system and may cause palpitation. So that's when the patient ends up in the hospital. So usually after a hospital, after a holiday, the ERs are going to be full with people who celebrated during the holiday, and like the day after, the number of ER visits increase. And so that's when you'll commonly see the holiday heart syndrome. All right, so let's go to our next one, everybody. Question 16. A patient presents with a blood pressure of 85/50 and symptoms of dizziness and fatigue. What is the most likely condition? Is it A, hypertension, B, hypotension, C, hyperkalemia, or D, tachycardia? A blood pressure of 85/50. And Karen, you are rocking it this morning, young lady. I'm so proud of you. And so, everybody, revealing the answer in 3, 2, and that's right, Karen, America, Johnette, and Quarku. You have it correct. It is B, hypotension. So, blood pressure of 85/50 indicates hypotension, which can lead to reduced blood flow to vital organs and symptoms such as dizziness and fatigue. Question 17. What is a major complication of untreated hypertension? Is it A, hypotension, B, cardiomyopathy, C, stroke, or D, pulmonary embolism? When those pressures remain too high for too long, what could happen as a consequence, as a complication? All right, we'll reveal the answer in 5, 4, 3, 2, and this one's a little bit tricky. It's going to be stroke. The arteries can't withstand all of that pressure. And so whenever there's too much pressure within the artery, eventually it's going to rupture. It's going to cause an aneurysm. And if that aneurysm happens in the brain, they're going to have a brain hemorrhage, aka a stroke. So uncontrolled hypertension can lead to a stroke due to damage in the blood cells, particularly in the brain. Next question, question 18. When measuring orthostatic blood pressure, which sequence should the CNA follow? All right, so if you're a CNA or a nursing student, what do you want to do first? Do you want to take the blood pressure supine, standing, and then sitting? That'll be A. Or B, sitting, standing, and supine. C, standing, sitting, and supine. Or D, supine, sitting, and standing. Ooh, that was a lot to say. But it all makes sense. If we're worried about this patient's blood pressure dropping, what sequence would we be checking their blood pressures? I'll give you a few moments to think about this. So I give you 10 seconds to answer this one. All right, here we go, team. And I do see some correct responses. It is D. Yes, if we're thinking about a patient's blood pressure who is dropping, we just don't want to start by standing them up or sitting them up first. So orthostatic blood pressures are measured in 3 different positions. First, while they are lying in bed to see if it's even safe for them to stand, because if the pressures are low, you're going to keep them in the bed. All right, and so now that you've documented the pressure when they're lying, you're going to have them sit to the side of the bed and repeat the blood pressure. See how they're feeling. Are you dizzy? And then lastly, you're going to stand them. If you need to physically give them support by holding them as you take the blood pressure, you can do so. But the goal would be to see if their blood pressures drop when they are walking or when they're changing their positions. And that's what orthostatic blood pressures are for. Is to help the nursing team and the doctors diagnose orthostatic hypotension, or blood pressure that drops due to different positions. Question 19. What condition is most often referred to as a silent killer? Is it A, myocardial infarction, B, tachycardia, C, atrial fibrillation, or D, hypertension? What is the silent killer? Oh, that one was really easy. Yes, Medisha. Yes, I see correct responses. It is D, because people walk around and sometimes they don't even know that they have hypertension if they're not checking their blood pressures. And so usually by the time that they are, even aware that they have the condition, it's because their head is hurting, they're having migraines, and by then that means that they've had elevated blood pressures for a longer period of time, and it's already caused some cardiac or coronary damage. So hypertension is called a silent killer because it often has no symptoms but can lead to severe complications if left untreated. And so this is a table here that talks about the different blood pressure categories. And I know that in most of your nursing and CNA books, we'll say that a person has hypertension if their blood pressure is 140 over 80 or greater. But according to current standards, they're now diagnosing patients as hypertensive if their systolic blood pressure is greater than 130. So whenever you are taking your CNA exams, your nursing exams, you go by what your professor, what your book tells you. But once you're in the medical field, if you hear a patient diagnosed with hypertension and their systolic blood pressure is only 138, don't freak out. They just have new standards. All right, so question number 20. What is the primary purpose of using TED hose in patients at risk for venous thromboembolism? Is it A, to treat hypotension, B, to treat venous stases and improve circulation, C, to increase heart rate, or D, to stabilize blood glucose? Let's see what you have. All right, we'll reveal the answer shortly. Yes, team. Yes. So when we have you putting on those tight stockings, those compression hose, it's for a reason. It is B, to prevent venous stases, blood just pulling in the legs, and to improve circulation. So TED hose help to reduce the risk of blood clots by promoting venous return and preventing venous stases in immobile patients. All right, let's go to the next one. Question 21. A nurse is caring for a patient with tachycardia and a blood pressure of 90 over 60. Which intervention should be the priority? Is it A, encourage deep breathing exercises, B, apply a warm compress to the chest, C, elevate the legs to promote venous return, or D, restrict oral fluid intake? What do you think, team? All right, let's see. I don't see the correct response just yet. So I'll give you a few more seconds and we'll reveal the response in 5, 4, 3, 2, and when someone has hypotension and it is symptomatic, you are often going to have a nurse who asks you to put the patient in a Trendelenburg position. So you are correct. It is C. We're going to elevate those legs to get all of the blood that's kind of like just stuck in the legs. We need to push it back towards the heart and the brain. So you only would put a person in Trendelenburg when your nurse tells you to do so. And the reason for it is because elevating the legs can improve the venous return, support the blood pressure, and reduce the symptoms associated with tachycardia and hypotension. However, it's just one step. That nurse still probably needs to give medications. She needs to hang some IV fluids and probably call the doctor to withhold some other medications that could be causing the blood pressure to drop. So this is the position that we would use. But again, you would never do this without a nurse telling you to do so. Question number 22. Which heart rate range is expected for a patient experiencing sinus tachycardia? This one's tricky. Is it A, less than 60 beats per minute, B, 80 to 100 beats per minute, C, 100 to 150 beats per minute, or D, greater than 200 beats per minute? So we're trying to see if you know what sinus tachycardia is. What heart rate range is for sinus tachycardia? Ooh, let's see if you know it. I'm just over here smiling because, yes, you all know it. I am so proud of you. All right, so yes, I'm goofy. Congratulations. All right, so no one chose D. It is C, everybody. It is 100 up to 150 beats per minute. So sinus tachycardia is characterized by a heart rate between 100 and 150 beats per minute due to various factors like exercise, fever, stress. So in contrast, whenever the heart is beating higher than 150, whenever it's approaching 200, that's usually not sinus tachycardia. We call that supraventricular tachycardia. And so the difference is sinus tachycardia, we're monitoring the patient. It's not necessarily a medical emergency. If we treat the infection, if we treat the dehydration, their heart rate is going to go down less to 100 versus SVT, supraventricular tachycardia, that is more severe and often life-threatening. And so this is an illustration here of the conduction system. And so if it starts off the right way, it starts off at the SA node. And so that's going to be the first arrow. And so that's where your sinus rhythms originate from. If it's SVT, it bypassed the sinus node and it originates from the atrioventricular node. We call that the AV node. And so that is why whenever you have a patient who has these fast heart rates, regardless of the reason, you get your nurse in the room, because your nurse, if a cardiologist isn't already consulted, your nurse will call the doctor who will consult a cardiologist so that we can find the underlying reason for this fast or rapid heart rate. All right, so let's go to our next one. Question number 23. A 15-year-old patient experiences a syncopal episode. They get faint, you all. Syncope is when someone passes out or they faints. So a syncopal episode during a basketball practice. Which congenital heart defect is most likely to cause this symptom? I know you all only think about adults, but yes, kids and teens have cardiovascular issues also. So would this teen have A, patent ductus arteriosus or PDA, B, hypertrophic cardiomyopathy, C, atrial septal defect, or D, mitral valve prolapse? And I'm so excited for you all as you go to nursing school, as you learn some of these terms, as you get your feet wet, whether you're working in pediatrics or adult units. Just do everything that you do with passion and with integrity and take great care of the patients, because you one day will encounter a teenager who has C, hypertrophic cardiomyopathy. So when you watch TV, you watch the news, and they say an athlete, unfortunately, they need to perform CPR on them. They had to use the AED. That athlete probably had an underlying heart condition that wasn't caught during their physical, that wasn't detected as a child. And so HCM is a common cause of sudden cardiac events in young adults. Young athletes. It involves thickening of the heart muscle, which can obstruct blood flow and lead to syncope during physical exertion. Question 24. If an AED is used on a pregnant woman in cardiac arrest, which of the following statements is correct? A, AED use is contraindicated in pregnancy due to potential harm to the fetus. B, special pads must be used for pregnant women. C, chest compression should be avoided until after AED use. Or D, the AED should be applied following standard guidelines, as it can be life-saving for both mother and baby. Have you ever thought about how AEDs are used on pregnant mothers? All right, let's see what your answers are. I see B's, I see C's. You're right. It doesn't say A, B, C, D. It says four. So, Barad, you are correct. Karen has D. So, yes, four or D, whichever you chose, is the correct response. So, the AED should be applied following standard guidelines as it can be life saving for both mother and baby. An AED can safely be used on a pregnant woman in cardiac arrest. So, don't delay. Call 911, call for help, but we're going to use the AED on mom. The primary goal is to save mom's life, as this directly increases the fetus's chance of survival. No special paths are required, and compression should be started immediately if indicated. So, yes, we are going to help save the baby by saving mom, and we're going to go ahead and use the AED on mom. All right, so everybody, question 25. We're on our last question. So thank you for studying with me bright and early on a Wednesday morning, pre-Thanksgiving. And if I haven't told you already, happy Thanksgiving. I hope that you have safe travels. But question 25, a 55-year-old woman arrives at the emergency department with fatigue, nausea, and back pain. She denies having chest pain. What should the healthcare provider suspect? Is it A, gastroesophageal reflux disease or GERD? B, panic attack? C, a typical presentation of myocardial infarction or MI? Or D, muscle strain? I am so proud of you. Yes, you are correct, you all. So remember we talked about hypertension being a silent killer. Research has indicated that women and men suffer from cardiac arrest, from myocardial infarctions at the same exact rate. However, you rarely ever see a woman on TV saying that she has chest pain or going into cardiac arrest. Maybe it's because they don't want to expose the chest, but it gives the public the perception that women do not have myocardial infarctions, that we don't have chest pain, when in fact, it's usually going to be atypical. We may have back pain, we could have nausea and vomiting. So if a woman presents in your hospital, in your clinic, and she's complaining of some abnormal symptoms, don't just totally throw away the fact that she could be actively having a heart attack right then. Get that EKG ordered. So the answer is C, a typical presentation of myocardial infarction, because women often present with atypical symptoms such as fatigue, nausea, back pain, shortness of breath, or jaw discomfort, rather than the classic chest pain seen in men. Recognizing these symptoms is crucial for prompt diagnosis and treatment. So I am so absolutely proud of you. Tomorrow, which is Thanksgiving, I'm going to be on here with 100 practice CNA questions, fast paced. I don't know what time. I'm probably going to do it at 9 p.m. to make sure my family doesn't get upset with me that I'm working on a holiday. Forgive me. All right. But so 9 p.m. tomorrow, I'm just going to set that. I will go ahead and we will come online if you're available. And after you do enjoying time with your family, we're going to study and prepare for our CNA examinations. And if you haven't done so, go to our website, fltraining.com. But specifically, if you go on Friday, you're going to see that our workbook is available for $9.99 and it ships globally. So it's just not for those in the US, it's for those all around the world. And Barad, Karen, woohoo, Korku, I am so proud of you all. So thank you, thank you, thank you. Have a happy Thanksgiving, everybody. And I'll see you tomorrow at 9 o'clock. And I'll make sure that we probably need to go ahead and do some type of game also. So tomorrow will be a practice test, and then maybe on Friday or Saturday we'll do a Kahoot. So I love you all. Bye. Happy Thanksgiving.